Good afternoon and welcome back. Today we're joined by Dr. Adam Hersh, Professor of Pediatrics Infectious Disease at the University of Utah and Primary Children's Hospital, and Ben Horsley, Director of Communications for Granite School District, to discuss COVID-19, school, and children. It's been a couple months since the last time we had Adam on, and we had him on with Emily to talk about the effect of COVID in children. And today we're going to be opening that discussion up a little bit more specifically to schools. Thank you both so much for joining us. It's nice to see you. So I'd like to start out the live with having each of you introduce yourselves and what your role has been and if it's changed at all during COVID-19. Adam, we'll start with you.
Hi, Adam Hersh. I work at the University of Utah, and my work involves the practice of pediatric infectious diseases at Primary Children's Hospital, but also clinical research in the epidemiology of pediatric infectious diseases. During the COVID pandemic, I've been involved with the state and local district levels around school outbreak investigations and school policies around COVID mitigation.
And Ben, what about you?
I'm involved in just about every aspect of COVID when it comes to our school plans, planning this last summer with the enhanced goal of creating a safe environment for our staff and students. And so that has obviously been modified as we've seen data come in with respect to COVID. I don't know about anybody else, but this is our first pandemic. And so we're kind of just working through new and changing information on a regular basis. And it's been exciting to see that data come in and alter our plans to modify and meet the needs of our students and our staff to, again, make that a safe and welcoming environment and continue on with education in the midst of a pandemic. The most recent obvious change has been obviously being able to offer the vaccine to our teachers, which has been an exciting development over the last few weeks.
And we'll talk about that as well and kind of how that's changed the perspective. But before we get into that, Adam, I want to talk to you about what we kind of know about school transmission from a local and national level, especially from August to January. It's been about 6 months since students have gone back to school.
Yeah, it's a long time ago now, and our understanding about transmission and ways to prevent transmission has evolved quite a bit. I think it's important to think about this contextually over time. First of all, Utah was one of the first states in the US to announce a mask requirement for school. So early in the summer, it was announced that our schools would be, our school districts would be allowed to develop their own learning plan, which generally was going to favor in-person learning, but it was going to be required that all members of the school community would wear masks at all times. And that was actually we were one of the first states to make that announcement. At the time we were learning, over the summer, we were learning or unlearning some bad assumptions that we had made. There were some thoughts early on in the pandemic that children didn't really get COVID, that children didn't transmit it efficiently at all. And then we learned pretty abruptly during the summer that that wasn't true. We were learning both locally here that there were significant transmission events happening in daycares where masking was, of course, more difficult, and where universal masking wasn't really kind of the norm. We were also learning from some of the summer camps nationwide that there were big outbreaks among children, really, really large numbers of campers getting infected in overnight camp settings, for instance, and in some cases up to 70% of members of camps. And so some of this got extrapolated to thinking about schools and thinking, oh my gosh. And I should also add that we had learned by then that households, within households, it was not uncommon for half or more of the household to get infected once one person got infected. So there was a lot of question, are schools going to look like camps where 50, 60, 70% of people are going to get infected? Are they going to look like households where there was still a lot of transmission happening? Or are they going to look more like the healthcare setting where people are wearing masks all the time, washing their hands a lot, keeping their distance when they could, where there was very little transmission happening, save for instances where masks were taken off, like in break rooms? Well, we plowed ahead here in Utah, and majority of our schools statewide have been open since September, and we've learned quite a bit as a state that's had some of the most open schools of any state in the country. We've learned that with really strict enforcement of mitigation strategies, including universal masking, hand hygiene, cohorting, distancing, ventilation when possible, staying home when sick, symptom screening, et cetera, that transmission on school property is very infrequent. We now have a number of studies nationwide, as well as data locally here in Salt Lake County, as well as in Utah, that suggests that an upper bound for the likelihood of transmission inside a school building in the normal daily activities of school is somewhere in the 1% to 2% range. Again, in contrast to what we observed in some overnight summer camps where it might be 50, 60, 70%. So very different. And again, I emphasize that that's probably an upper bound for the risk of transmission. And so we've learned that we generally can conduct school safely. Kids can take advantage of the in-person learning opportunities, and that we can contain and really, in many cases, eliminate large outbreaks and largely contain spread with strict adherence to all of the mitigation strategies, most importantly, universal masking.
Another question I want to ask you really quickly, Adam, is what are some important remaining unknowns that we haven't quite figured out when it comes to having children back in school and COVID-19?
Yeah, so this is a very nuanced discussion because I think, as a lot of listeners know, in association with the reopening of schools, we saw a big surge in cases among school-age children, across all ages. Started with university ages, then to high school ages, then middle school, then elementary. I mean, it was just one after the other. The remaining questions are where and how are those transmissions occurring? It seems, based on an accumulation of data throughout the fall and into this winter, that most of those transmissions are happening among people who attend school, but during activities outside of school, not inside of school. One of the really important remaining unknowns is around high school. High school age students have the highest incidence of any school age group that we have. That's true locally, that's true statewide, that's true regionally, that's true nationally. A lot of that has to do with the fact that high school age students have a lot more independence and autonomy and freedoms to socialize and to interact very differently than elementary age students do. Adherence to masking may be different, risk-taking behaviors may be different. So in my view, one of the most important unknowns is how to effectively work with high school communities, high schools and high school communities to find the right balance of supporting in-person school activities, conducting out-of-school activities, be those social interactions, extracurricular activities such as sports, how to allow for those to continue, but how to ensure that they're conducted as safely as possible. So that to me represents kind of the most important challenge that we face in going forward for the rest of the school year. It's keeping our high school students especially as safe as possible.
That kind of brings me to my next question. Ben, this one is for you. What are some key things that schools are doing with migration strategies for COVID-19?
Well, I would just reiterate some of what Adam's already expressed to us. With his data is a reflection of our experience and what we continue to see. And what was so interesting this last summer is we had no idea what the data would look like. We just were proceeding forward knowing that some of these things worked well and keeping our fingers crossed that we could limit the spread of COVID-19 on our campuses. If you had told us the data that he is sharing now last summer, I think returning to school would have been a no-brainer at that point in time. It was very clear that we are seeing very low rates of transmission on school property. But to his point, we're seeing very high rates of transmission off of school property. And it is amazing, I mean, literally amazing how fast those masks come flying off in the high school parking lots as soon as kids are leaving the campus. And so we do see those same kids interacting together on campus while wearing a mask and using these mitigation strategies that we have in place. Those work better than others depending on the circumstances. We do see a lot more kids being a little more relaxed than they should be. I got a social media picture the other day of one of our cafeterias where kids were not socially distancing and eating their lunch. And it's hard if you only have 3 administrators in an entire building of 2,200 high school students, and trying to keep kids continually separated to the highest degree possible. It's a challenge, and it will continue to be a challenge. That being said, what we are seeing is, by and large, our mitigation strategies are working on campus. And what we are seeing is our communities are actually learning and getting better at following the rules as well. One thing we're not seeing a lot of that we saw prior to Thanksgiving was, because the schools were not hosting dances or other social activities, parents took it upon themselves to make sure that though their kids weren't missing out on some of those important milestones and social activities that high school offers. We saw Halloween dances and we saw outbreaks. And it's important to understand, a lot of people say, well, how many cases does your school have, or do your district? Schools don't get COVID, but we are impacted by COVID and those cases, regardless of whether the transmission occurred on school property or not. So we continue to work to harness the best mitigation strategies possible to prevent spread. One thing we know for sure is that masks work. And so we want to make sure that we continue to reinforce that principle first and foremost.
You mentioned the dance aspect. This is not a question I thought I was going to ask you, but you mentioned it. I know that prom is something that a lot of high schools have. Are there plans to have prom, at least from your district standpoint, during the pandemic?
It's one of those things where I think we need to recognize and understand what an incredible privilege it is to go to school in the midst of a pandemic. And to be honest, I think a lot of families really kind of take that for granted. And so they are expecting an enhanced, normal, traditional experience. And we are still in a pandemic that has not changed. And with the advent and push of the vaccine, with respect to this particular school year, I do believe that we will continue to reinforce these mitigation strategies, which mean limiting certain types of social activities, including dances. We have tried to make up for that in other ways, because we do want our kids to have an enhanced high school experience, as it were. That goes to their social, emotional well-being as well as much as their physical well-being. And so we've looked at other ways to provide other activities that allow for social distancing, allow for that engagement without the proximity and the crowd size that a dance would bring. So prom is going to look a little bit different this year. Probably a bit different, but to be honest, that's not necessarily a bad thing. A lot of people were really worried about graduation ceremonies being disrupted this last school year. And I'm going to tell you, most of our schools are not ever going back to what we did before. That tradition has changed now, and we expect a lot of those new changes to be implemented in upcoming graduations and from here on henceforth, because they were so much more popular and allowed for a lot more actual family interaction. So I expect that we're going to actually do some new things that will actually be quite popular.
So change is not a bad thing, it sounds like. And
not always.
Not always, no. And I know that that's far away. So obviously, as things adapt, you guys could potentially adapt. I want to also talk about a lot of new testing policies that school districts have in place, specifically around after school activities, this concept of tests to stay and tests to play. Can you kind of explain what those are?
Yes. So what happens if you are part of a high school activities association sponsored activity, which could range from debate to sports? We've also implemented test to play as part of our choir concerts and our play productions. And what it means is every Friday in Granite School District, this could be a little bit different in other districts. You come in, you get a rapid antigen test that gives us a quick result within 15 to 30 minutes. And if you test negative, you are allowed to continue to proceed within that activity for the next 2 weeks until you get tested again. And the idea is ramping up testing in addition to the other mitigation strategies that we have in place already that are more enhanced than we see for just the regular traditional student, such as temperature taking, mask wearing when you're not actually engaged in the activity itself, some of those other strategies. the testing actually works to ensure that we're not having asymptomatic kids participating in those activities.
And Adam, why are these new testing policies that have been put in place so important for us during school?
Well, there's a number of reasons why. First and foremost, we know that, let's just, to make it simple, let's say half of people infected, and especially when we're talking about youth, at least half of students who are infected with SARS-CoV-2 will be asymptomatic, or as sometimes is described as post-symptomatic, really, really minimal low-level symptoms. And so the benefit of testing, and what Ben was describing as really screening, which is testing people who don't have any sign of the disease. What that does is that helps us identify individuals who might be contagious, but not know it and not have already taken themselves out of circulation. And so the tests that we're using do help us find some of those asymptomatic individuals. I think it's important for people to know, however, that the rapid tests that are used, the rapid antigen tests, to be distinguished from the PCR or the molecular tests, which take a day or two to get a result. The rapid tests have a lot of advantages. They're done, the biggest advantage is that they're rapid and you get a result really quickly, and you can take the appropriate actions more quickly than if you have a molecular test. But it is important to know that those tests have some limitations to their accuracy, and they don't detect everyone who is infected with the virus. But one view is that some detection is better than no detection, because before we were doing these new enhanced testing strategies, we weren't doing them. And so a lot of these students may have never been detected and may have gone on to pass this virus on to their family, friends, etc., unknowingly. So more testing, better. And we're doing a lot more testing statewide, not just for school-age kids. And the really good news is, with all this increased testing, we're not seeing cases going up. And that's a really important, because the more you look, the more you'll find. But with all the increased testing, we're not actually seeing more cases, but we are potentially finding school-aged individuals, especially those who are engaging in extracurricular activities, for instance, sports, because as it stands now, on the field of play, we are not requiring masks in the state. So by testing people with regularity, we can identify more of those asymptomatic individuals before they step on the court or the field of play.
Could I just add to that really quick? I think the important component to what he's saying is the fact that our strategies are about mitigation again. It was never about complete elimination of spread. We know spread's going to occur. There's just no possible way. It's about how do we reduce that risk to the minimal amount possible to make it as safe as possible and still be able to do these different types of things that are very important.
And one of the challenges in messaging with test to play and test to stay, which we could also just help explain to the audience, is that people really need to understand, and this can be harder, well, it's hard for anyone, but people really need to understand that that's a snapshot in time. And that test is really telling you about, a couple days ago, not even the last hour, and certainly nothing about your, the likelihood that you'll be positive tomorrow. So it's a snapshot in time, and it's definitely not a free ticket to take your mask off and put those mitigation strategies aside.
Did you want me to go through test to stay real quick?
Sure, yeah. If you want to explain that a little bit further, that would be great.
So before the new year, 2021 and 2020, this last fall, we were implementing a strategy under state protocols. When we reached a certain amount of cases within a school, 15 cases or more, we would implement a distance learning option where everybody would go home for 2 weeks, and we would just do distance learning for everybody. That could be a big disruption. We had 2 high schools that had 3 different distance learning components before Christmas time. And so going back to school and then going home, the yo-yo effect can be really challenging. The state recognized the data that Adam was discussing earlier, the very low rates of transmission. Particularly, we were over quarantining. We found that less than 1% of those who had technically been exposed on school property actually came down with COVID. So again, the masks were very effective. So the state changed the protocol up a little bit, and we piloted this new test to stay protocol just before the winter break. And what we found is we'll come in and do these rapid antigen tests for everybody who's willing to participate student-wise, and we have permission to do so. We've seen participation rates between usually at least 80%. One high school just last week had 95% participation from students. And so kids clearly want to be in school, which is something that hasn't happened in a really long time. So again, trying to see the bright side of COVID here. But we did 4 schools just in the last week or so, and allowed those kids to stay in school if they would come and get, as Adam indicated, a shot in time, a negative test result. Skyline had 1 additional case that was discovered. Olympus and Taylorsville, who also did test to stay, found 6 additional cases. And Taylorsville and Cottonwood had 6 cases. Olympus had 4 cases. And so what we're finding is, again, not many more additional asymptomatic individuals. So why are we releasing kids to go home for distance learning, which is clearly not as effective as in-person instruction, when we're not seeing more infection and more transmission?
It's interesting that those cases are so low, because kind of what you have seen and heard, especially since August, is that it is spreading via schools. So it's interesting that you guys have been able to kind of track that data to kind of prove that this is working, which I think is great. And you brought up the quarantine policies, specifically around what happens if you're exposed or do have COVID. Adam, I'll start with you. Do you kind of want to explain what those new policies are and if they've changed at all in the last little bit? And then Ben, we'll have you go next.
Yeah, and there's a long history in our state on the story around school quarantines. We've gone through a few different iterations, but starting at the beginning of the school year in the fall, close contact exposure, which would result in quarantine, which at the time would be 14 days, which was 2 weeks, it's a long time, was defined as being within 6 feet of a case for 15 minutes or more, regardless of mask. We learned, as Ben alluded to, among other data sources, we learned that the punishment wasn't fitting the crime. We were quarantining based on that definition, lots and lots of people, and not just in schools, but also, for instance, in the healthcare environment, in other workplaces. We were quarantining people regardless of mask use, and we found that when masks were used, the likelihood of transmission, even with quote unquote close contact, was very, very infrequent. Even within 6 feet, in a small room, let's say, having a meeting, etc., as long as masks were worn. So recognizing that we were quarantining a lot of individuals who didn't end up needing to be quarantined, and that was very disruptive for their learning or for work, etc., the state policy changed to say that quarantine was not required so long as the exposure occurred in a school-related activity, and so long as masks were worn on both individuals. And this is really just policy evolving based on data, starting off with a more cautious approach, which I completely support and supported at the time. As we learned more, it's not to say that we became more lax. No, it's not more lax. It's learning more and allowing our policies to evolve based on scientific evidence. And so currently, as long as you wear your mask in school, you're not going to get quarantined. And that has had very substantial effects, beneficial effects on the learning model and reducing disruptions, reducing large numbers of people going in, out, in, out. I should also point out that early in the fall, we were proud that we were one of the first states to modify our quarantine to shorten the duration of quarantine for school-related exposures from 14 days to 7 days with a negative test. And that has actually become the norm nationwide for quarantine strategies.
I have a quick question around the fact that you wouldn't quarantine them if they're both wearing a mask. And maybe, Ben, you know the answer to this. Is it we're going to take your word for it type thing? How exactly does that work? If a student does get exposed, do you just take their word that they were wearing a mask the entire time? I know that's slightly nitpicky, but there is a chance that the student wants to stay in school and it's like, I know that if I tell them I'm wearing a mask, I don't have to quarantine. Has that happened at all?
Well, we have actually mask police. I'm just kidding. There are no such thing as mask police. But what we do find is through our contact tracing efforts, when we speak to multiple individuals who are a part of that exposure or within the room, we're usually able to verify mask wearing and determine if somebody's not being forthright with us. And so, and to the point that Adam made prior, we've been overly cautious on that front. So if there's any question whether the mask was being worn or not, we'll err on the side of that it wasn't being worn properly and still initiate a quarantine as appropriate. But we've seen very little instances where we've not been able to verify that.
My next question. Sorry. Go ahead.
Masks, masks are required. It was kind of painful at the beginning for people to get used to it, but go walk around schools these days. Everybody's wearing a mask. So
I think I think a lot of people really assumed that it was going to be difficult. It's not. Kids are great. Kids get it. Again, they are motivated to be in school. They want to be there. They do not like distance learning by and large, and they like being there with their friends and participating in the instruction with their teacher right there. And so they are motivated to wear that mask and stay. We had some individuals being quarantined 3, 4, 5 times prior to the change, simply by virtue of the fact that they just happened to be in the room. Think about this on the prior policy change when it was 15 cases. If you went through those 15 people into 8 different classrooms over a given 2 days, you've now potentially exposed half the school to somebody being in at least the same classroom, if not within that 6 feet. And so we literally were quarantining hundreds and hundreds of students unnecessarily, and they were doing an awesome job wearing the mask, right? And so we've not seen an increase in numbers with this policy change. So it clearly is working. The data is working.
I have a question around for both of you around what you think that we can still do to improve, specifically when it relates to schools. Ben, we'll start with you.
What can we do to improve? I think we need to keep watching the data. It was funny, last summer, you wouldn't believe how many emails, listen to the scientists, listen to the data. And I got to tell you, that is all we've been listening to. Granite School District has been one of those districts. We have stuck by the guidance from the state COVID task force and the state health department and the Salt Lake County Health Department to a T. And have we pushed back on some of these different things as we've seen the numbers coming through, working with the University of Utah, some other various research institutions to allow them to come in and do testing and research to help us understand this a little bit more. We were so pleased to see the changes and adjustments to the policies themselves, and we anticipate the only way we can improve what we're doing right now is to continue to adhere to the things we know are working and to continue to get as much data as we possibly can. And then that can help guide those decisions, listen to the scientists, they know what they're talking about, and be able to improve the circumstances and situations, perhaps being able to engage in some of these other activities with some certain limitations. Maybe prom can happen after all if we can gather some more data and identify ways to do those activities, again, in a safe manner based on the data that we continue to collect and in conjunction with great partners like Adam and the state and the county.
And Adam, what about you from your perspective? What can Utah and schools do to improve?
I think that we can continue to model. We've really learned that youth can wear masks for prolonged periods of time, and we've learned that, and we've known from the beginning, but we've really seen that it's what you do outside of school that has a big impact on your ability to go to school in terms of staying healthy and safe. And so we definitely can improve at the community level in encouraging and continuing to normalize high mask compliance outside of school and in all interactions with groups. I think we really need to continue to engage in challenging conversations around vaccine hesitancy. Vaccine uptake is a real big barrier to getting to the end of this. And while a lot of people are very eager to get a vaccine when they're able to, there's a substantial number of people who have ongoing concerns, and we need to address those concerns. We need to meet those people where they are and help them understand, address their concerns and barriers, and help them understand that vaccines are safe and effective. And that's kind of a longer term, that's a longer term challenge that we've got to really face up to.
Is there any last words that either of you have around what you've learned for the last 6 months, or anything else you'd just like to say today to our Facebook Live viewers? Adam, we'll start with you.
Well, I think when the story is written, you know, in the end, there's going to be a few things that stand out to me. Number one, don't doubt the youth. You know, if you remember back to the beginning of summer, one of the strongest arguments against opening schools was, especially for younger age children, was they'll never wear masks. Well, they have the best mask. The elementary age kids have the best mask compliance of any children. So, and as Ben has alluded to previously, by and large, kids want to be in school, and they'll be motivated if it means wearing masks or getting tested. If it's high school students that want to play sports, they'll do it because they want to be there. That's, you know, number one. And number two, I think when the story is written, I think we haven't, you know, we've had fits and starts, and we've had, you know, we've gone through some really, we are still in the midst of a really challenging period in this pandemic. We've been a national hotspot. And with all that, though, we've been aggressive about keeping schools open. And by and large, I think that was the right call, especially knowing what we know now. And so when the story is written, I think Utah school children are going to have had more opportunities to attend school in person than most of their peers nationwide. And I think that's something that we're all really grateful for, living here in Utah.
And Adam, what about you? Or sorry, Ben, what about you?
I'll tell you, you can call me Adam. And put the doctor in front of it, I'll pretend I'm smart. The whole notion of what he's indicated there, I think, is fairly profound, and I don't want to take away from that. I do want to give a shout out to teachers. I think there was a lot of unknowns coming into this school year. We really were searching out with the best data that we had at the time, knowing what could prevent the spread of this dreaded disease. And at the same time, a lot of teachers with high-risk circumstances and conditions were coming into classroom scenarios where they were not going to be able to socially distance 100% of the time, and most of the time, in fact, in certain scenarios. And so those are the real heroes of the pandemic, in my mind, is just these people who have been on the front lines working to provide a quality educational experience to kids. Because at the end of the day, man, our kids need this in their lives. It's a lot easier for us to work from home as adults than it is for kids to do distance learning. We've seen our numbers stay flat. We saw some recent data from the state health department that showed that suicides in the state are flat, and even in the midst of a pandemic. And I think it goes to the heart of the fact that kids are getting most of what they need in terms of some social emotional health. And we couldn't have done it. We could not have done it without our wonderful teachers being on the front lines and being willing to go into that classroom and provide that instruction. So just very grateful is what I want people to understand and appreciate.
Well, that was a great way to end. Thank you. I really appreciate that. And yes, I know that teachers have had a very hard time during all of this. So I'm very grateful for them and everything that they've been doing. Thank you both so much for joining us. I appreciate your time. And if anyone who's watching has any questions around COVID-19 and would like to see if they qualify for a test, they can go to intermountain.com/COVID testing. You'll fill out a quick survey that'll let you know if you qualify, and then you'll be able to choose an appointment arrival time for that. We also have an emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. It is a free service for our community, and you can get the support that you need just through a quick phone call. That phone number is 833-442-2211. Thank you both again, and we'll talk to you later.